All right, so we'll come back to Jake. His mystery illness will remain a mystery for now. I don't know if you guys recognize this. This is actually from your Gen Path lecture when we did vitamin D. Now it's time to talk about all of these things from the nervous system. Funny how things work out that way. So these black, this is called bold, sorry. These bold ones. So these are probably the most common things that you guys are going to see. So we're going to spend a lot of time here. However, I also like to spend a lot of time in congenital developmental because they have the coolest pictures. So we're going to talk about that first.
Real quick.
Yeah.
Can you go back and just point out the locations involved one more time? You were flying, so we missed them.
Brain and brainstem.
Okay.
That's the done set.
Thank you.
Yep. All right, so developmental disorders are fairly common in animals. They have diverse causes. Many are inherited, some are infectious, especially viral etiologies. There's a list of viruses that like to cause CNS developmental disturbances, some toxins, and then finally just sporadic. We don't really know the cause, it just happens. Major patterns of these disorders, you have failure to develop of either segments of the nervous system or, large, like you don't have a brain, stuff like that. You can get slowed development. So a lot of that has to do with neural migration during later gestations. Failure to develop is usually earlier gestation, slowing of development usually later while the cells are migrating to their final destinations. Premature degeneration. So abiotrophy is the term for premature degeneration in the nervous system, and that refers to degeneration of fully formed nervous system components. So it is considered developmental, but it's like developmental degenerative, if that makes sense. You get to a place where you're fully formed, and then they start to degenerate early on. You can have functional disturbances with normal tissue structure. So these often result in no gross lesions, but you have an animal that has very severe neurologic signs, and storage diseases like lysosomal storage diseases would be an example of that. And then finally, unknown things like idiopathic epilepsy, where there's clearly something wrong, but we can't identify either a structural or a functional basis for it. So it's just remains a mystery. And then a teratogen, you guys have heard this word before. So teres comes from the word monster, and Genesis is creation. So a teratogen is a substance that creates a monster out of an embryo. Any agent or factor that causes malformation. So any of these viruses can be teratogens, toxins, often what we think of as teratogens. And then this is really important. The outcome of the insult is highly dependent on the timing of the hit. So it depends on your gestational age. This is human, obviously, but same pattern applies. Your greatest sensitivity to teratogens is going to be in this very early part where you're actually forming these large structures. And then later on, when you have the structures and they're just kind of migrating, you're less susceptible. That makes sense. And then this doesn't continue, but there is also postnatal development of many CNS structures. Primarily, cerebellum does a lot of postnatal migration. And myelination, you get a lot of postnatal myelination. So disorders of myelination can happen later in those stages. All right, sorry about this tiny embryology lesson. I'll keep it brief and simple. The neural plate is this purple guy here. So this is your primitive brain and spinal cord. This is the first thing that forms in your little blastocyst. It then folds. The plate becomes a groove, which becomes a fold. And then the fold has to seal at the top, and then it's a tube. Then it's the neural tube. And then it goes up to the brain and down to gut, and it forms your brain and spinal cord, right? Which is essentially a tube, right? The central canal and the ventricle. These genes are highly conserved. You guys know what that means? So if I look at a bunch of different species, look at all their genes for making this happen, they're very much the same because you need this for life. So bad things that happen here are not often compatible with life unless they're minor. So closure of this neural tube is very important, obviously, for the development of the brain and spinal cord, but the development of these overlying structures like your cranium, your dorsal vertebral bodies, the skin over that midline, all depends on signals from a neural tube that is closed. So if you don't get closure of the neural tube, you don't get closure of the stuff over it. Make sense? That's why the great pictures. All right. Neurotube defects, insults primarily occur during very early gestation while this neural tube is forming from the fold. Dysraphism, a raphe or raphe is a midline. So dysraphism means any incomplete closure of a midline, such as the neural tube. It's also called schisis, like cranioschisis. You guys think of other dysraphisms not in the brain or spinal cord? Bad things that happen on midline.
Spina bifida.
Spina bifida, yeah, that's a CNS one. Any urinary? Oh, hypospadia, yeah. And then there's one that doesn't seem like a midline. It's on the inside. You forget about it. PPDH, peritoneal pericardial diaphragmatic hernia. That's failure of a one in the mouth. The dog with it. The palate, yeah, palatoschisis. Cool. All right, so these neural tube defects are a spectrum of lesions depending on, again, the nature and the timing of the insult. Earlier insults will be more severe. In the brain, we see primarily anencephaly. This not or no brain. And then encephalocele, meningocele. Cephalo, brain, meningo, right? You know what a seal is? Like a cyst, kind of. Like a hydrocele. And then spinal cord. Somebody already mentioned spina bifida. Clearly reading ahead. This actually refers to the vertebral defect. The spinal cord defect is a myelia or hydromyelia. And then a meningomyelocele. All right, so here is anencephaly, literally means no brain. As you can see, he does have some kind of like nubbins of like brain soupish. There's something in there, but it's not a whole brain, and his forehead and the top of his head have not even developed. So lots of associated defects with this, as you can imagine. Cranioschisis, which refers to that actual defect in the skull. Exencephaly, what's that? What's X? Outside, so your brain is outside. That's actually often what causes degeneration of this tissue is the brain tissue is directly exposed to amniotic fluid. So whatever tissue is in there just kind of can't work under these conditions. Microphthalmia, what's that? Micro? Small eyes. Anophthalmia, no eyes. All right, here's the seals. Aren't these fun? Couldn't you just look at these all day? Look how cute this thing is. What? So encephalocele and meningocele is actually protrusion of either meninges, brain, or both into this big kind of sac looking thing that protrudes from the midline. Here it is in a turkey, pretty unusual lesion. You can see this guy also has some facial deformity compared to his friend here. This guy has got, I don't even know what going on. Where's your neck? Spinal dysraphisms. All right, so same thing, but back. Spina bifida, again, this refers to the secondary vertebral defect and not the cord. So when you say spina bifida, you're talking about missing these vertebral bodies. Neurotube defect rules apply, so same type of insults. The presentation is variable depending on how severe it is. They usually occur in the lumbosacral area. Occult means hidden, like not occult, it's a secret. Don't tell me, I don't want to know. Where the only sign is a little dimple in the midline skin overlying the defect. See that there, so small. So that's technically a form of spina bifida when you have this little defect. Sometimes they have a little cyst, not a cyst, like a little track. So Rhodesian ridgebacks often get what's called a dermoid sinus, which is very like the most minor possible neurotube defect you could ever have, where they just have like this little pimple on their backs. But there's a little track that connects them. So sometimes they go from the skin surface to the vertebral body, like the supraspinous ligament, or they'll actually go to the dura of the cord. So they can occasionally get, infected because it's a open trap. But that's a rhodesian ridgeback thing, because we bred them to have that weird midline stuff. What do you call it? The ridge. Yes. And then the actual spinal cord defect. So again, it's going to be lack of a cord, hydromyelia. What's hydro? Water. So this is like a hydrocephalus in your cord, right? Massive dilation of the central canal with reduced amount of actual spinal cord tissue. And then myeloschisis is that defect, failure to close. Again, you can have meningo and myelo, sorry, because that's the cord seals. Manx cats have a syndrome of sacrococcygeal agenesis. So things we breed to have short tails often have caudal spinal issues. Spina bifida. So here in cross section, probably the best image. Here's the disc, the annulus, nucleus pulposus. Here is where the cord is supposed to be, and look at this big. What is this? I don't know. Here's the vertebral body. It's not closed over the top, and you have protrusion of what would you guys call this? Name the defects. Give you a hint. The spina bifida, right? What's the cord? What's protruding? A seal. What kind of seal? Meningo seal. Good. Here is a longitudinal section. You can see follow the cord down here. Cord gets a little funny. All of a sudden, dorsal vertebral bodies disappear. Right. Here's a very minor case. You can just see some stuff protruding through the skin. This is important to note that if you don't get development of the spinal cord back there, you don't get good development of the rest of the stuff, right? So this guy has severe muscle atrophy. You guys know the term for this? It starts with an A. You'll hear it a lot in repro. This is arthrogryposis. This is messed up, wrong bendy legs in a baby. All right, so what would you guys call this other than spina bifida? What's this up here?
Anencephaly.
Exencephaly? Do you see a brain? No. So it's anencephaly. And what's the skull defect? Cranioschisis. Nice. And then spina bifida. This looks like, what would you call the spinal cord defect here? Do you see a spinal cord? So it's myelia. 2x combo bonus. Game over. All right, so here's another example of spinal dysraphism. So this would be a hydromyelia, and you also have a dysraphism here. So the meninges look like maybe they go all the way over. I can't tell what's happening back here. But this neurotube is not closed, and you have massively dilated central canal. So this is hydromyelia. This dilation, if it's focal, is sometimes called a syrinx. We're a syrinx like the bird voice box. So this is also called syringomyelia if there's a focal dilation of that central canal resulting in a little bubble. Cerebrocortical dysplasias. So these are after neural tube closure, but they're still kind of in early fetal life. And these are things that interfere with that cellular migration, which there are many waves of. It's very complicated. Don't worry about it. The consequence is that these are often combined with other neural abnormalities. Many of these are caused by viruses. There's the list. A lot of these are also the things that cause arthrogryposis. All right, so here are the dysplasias. Microcephaly, which means small brain. Do you guys see any other defects? The cerebellum, it's so small. So what do you want to call that? Cerebellar hypoplasia. All right, let's figure out the words time. What do you think? Polymicrogyria. Many small gyri. Do you see that in this image? There they are. This is kind of normalish distribution of sulci gyri. This is abnormal. That's technically a dysplasia. About pachy. Thick gyri. This guy has like 2 per side. Good on him. And then lys. What does lys mean? Smooth. This is smooth brain. No gyri.
That's how I feel like my brain.
Keep in mind this is normal in birds and rodents and rabbits.
And koalas.
But this is a loss of ossa, not normal. All right, so what does this mean? Encephaly is brain. What's hollow? What's holistic? Holistic. Whole. And what is the prosencephalon? Forebrain. You have one forebrain that is not divided into hemispheres. So see, there should be division here. Should have a corpus callosum, but you don't. You have one big ventral. More severe forms have facial abnormalities that are similar. It's failure of separation into 2 things, so you get one eye. Sin is another fusion. Synophthalmia means I have one eye. All right, cavitating encephalopathies. These are the result of full thickness necrosis of the cerebral hemisphere during developmental periods. So you have formed, you've migrated, but then there's been necrosis and you've lost the tissue. So the empty space fills with CSF. This occurs in all species. It's most common in lambs and cows, particularly due to this etiologic association. This is another one that you see this lesion, you think virus. Arbovirus just means arthropod born. It's kind of it's not like a scientific classification. It's just a group of arthropod born viruses. So this list, pestiviruses, panloop, also does it. So hydranencephaly, this is water brain essentially, and then pore, cavity or pore, right? So porencephaly is the less severe version. Hydranencephaly means there's almost no brain tissue left. You've just dilated it and filled it with CSF. Porencephaly is less severe. You just have these big cavitated pockets in the brain.